This is a turf toe taping to help prevent turf toe injuries with the mechanism and pain that occurs in hyperflexion at the metatarsal phalangeal joint. First you need to, they need pre-wrap. You put pre-wrap on the males if you need to, or if the individual wants it. Otherwise, this is best to put against the skin with your spray. First, I'm going to cut off a small piece. These are going to be my anchors for my toe. I'm going to split it down the middle. Save one for later. This can go on your distal phalanx. Next, we are going to put an anchor down on the foot. You can either put a half anchor, or you can put go around the foot, but just make sure that when you do that, go lightly, loosely around it before you attach it, so that when the foot flattens, you won't break any bones or cause any sprains to that area. Next, we are going to make a TP, Christmas tree. With our 1-inch tape. You can measure from the top anchor to the toe to see what the distance is. You can either do all of this right on the person, making 3, 1 in the middle and 2 on each sides, overlapping slightly. Sometimes I'll put a 4th one down the center just for extra support. Or you can also do it another way. Measure the top, and then you're just going to make a TP on the table. Hopefully it's vinyl so it doesn't stick. With 3 or 4 pieces, like so. I like to attach it to the toe first, and then I will use my initial second half of my anchor to close it on the toe. And then, before I attach it, I want to communicate with the patient to see if that is adequate enough, and ask the athlete to hyperextend, see if they're in pain. If there's a little pain, I may need to come down a little bit more before I attach it. Again, ask her to pull back into hyperextension. If that's okay, she'll say yes, and then I will attach it on the bottom. Again, I can put bottom closures, halves, and then you can flatten the foot. Put 1 or 2 top closures. Or if you go around, just make sure that you go loosely. And then check the pulse, sensation, functionality of the taping.